Chapter 5.
Can we have a look at that picture? We're just going to show you a picture. This is a picture Sasha has of a patient. This will be a warning to you. The bad news is this character is green. This is what happens if you don't have the right food. Is it on the screen?
Not yet.
Oh, right.
Hang on. Here we go.
Diabetic, yeah. Diabetic foot here. Okay. Not gout, no. Okay. Do you notice the toenails? What do you notice in the toenails? Fungal, okay. And notice the skin on the shin. Very dry. Okay, this person's got an acute fatty acid deficiency or something, hasn't he? You know, this will persuade you to take the right oils in the diet, won't it? How long ago was the foot? How long ago was the picture? 2 weeks ago. He's already had the top digit removed surgically. The surgeon wanted to do another one, but they decided not to. Yeah, we're trying natural techniques. So oil is important here. Obviously the vitamins and minerals. The patient is 81. No, 83. 81. 81 is a good age for somebody in Russia, I can tell you. With a foot like this. He's had the top digit, remember? Yeah, but it's gone gangrenous again. Okay, should we take you now? Okay. Now the question is, should she take her glasses off? Not till she's got on the treatment table. Now these are dodgy. Get them down there first. You have absolutely no idea how bad some people's vision are if you take their glasses off. And especially if you then take them and put them on the other side of the room somewhere, they can't find them. So I put them behind you there, all right? Okay, so let's start at the beginning. So pull your knee to your shoulder, okay? Now, first of all, what I do is I just do a quick therapy localizer. It does not matter where you therapy localize here, as long as it's on two opposite sides of the body, okay? And you touch simultaneously. Try and avoid any known acupuncture points. That's okay. That's to test for a compression in the skull. Tap the reflex on the opposite leg. Muscle goes weak. Absolute perfection. Tap. So everything's fine as far as the mechanics there. Okay, so let's go right in there. And how tall are you?
5'2".
5'2". Okay.
I'm a green.
You can't be a green.
I'm only joking.
She's a green Irish. Well,
Green Irish blue.
But she could be green, in which case we definitely know there's a problem there. Yeah. Okay, so what we do now is we just test both eyes to make sure she's a green. Pull. She might be that green yet. Okay, so it must be the left eye. Now this is interesting. Which eye are you dominant with? Do you have a dominant eye?
Better eye, the right.
The right. Okay.
Slightly.
So let's go for the green on the right. Nah, not a bit of green in there. It's going to be red. Splendid. So she's red on the right, blue on the left, with the blue being the dominant one, a bit like Gandrew. So that would be her colours that we would have used to really do the diagnosis from. But if we'd used those, we would be looking at her what she is now, not what she is going to be. All right? So this means the reason for the change in the body type or constitution is ultimately from her thinking. And her thinking is tied in with her subconscious emotions or the memory. So we test right to left and then take them off, and then we do left to right. I don't know why it is, but 9 out of 10 times it's the left to the right. Okay, 1 in 10 would be right to left. And again with the reflexes, it's the same sort of thing. But you do sometimes get these crossing ones where one is one way and another sense is the other way. Okay, so what we've got is the left to the right, and we'll just give her the zapping there with the light. Yeah.
Did you say the conflict is usually, left to right, but her dominant brain, is that left?
Don't know.
Oh, you don't know that?
No, I don't think that matters at this stage. We'll do the brain in a moment with her, which one it is.
With healers, right brain dominant.
Yes, of course. Intuitive. We talk a lot about, right brain, left brain, don't worry. But at this stage, I just want to see and convert her into what she should be. Okay. Now, I'm doing this with New because she's not going to be here tomorrow. So I've already done her as a hair sample, so we know that she's probably going to be blue. So we'll see once we've done this. So therefore we needn't worry about the nutrients because we've basically done them already, and the oils. We can just we can skip that. But the reason I want to do her sensory inputs is because she's got visual problems of long sight and short sight. Okay, so the conversion is quite easy there. Okay, now, is she red? Is she blue? Is she blue in the right? Is she blue in the left? So you can have somebody who comes in and is blue. Okay, that's what they're showing too. But when you do this, they go wig, then you treat them and you find they're not blue at all. So they can have converted completely. So beware those, because the person then will go back to what their body shape and size really is. All right, so even a blue could turn to a red if they're slightly taller than the average blue person. So look at the hands, ask them how tall they are, and then work accordingly to their body structure and shape. Okay. Now I'm going to just assume that everything, and that's what I've already found, works as far as the nutrition there. So what I'm going to do, you'll all be given these. I notice these are, we really need these laminated, and they haven't, it's my fault entirely because we sent them off on acetates. The ink is very dry, but try and keep them facing upwards, particularly if the person's a bit sweaty, otherwise the ink might come off on them. But we will get the next batch of them, which we'll have to make a nominal charge, because they'll be laminated. We'll have to make a nominal charge because the laminating is quite expensive. So when you get these, and we'll be given those probably tomorrow, what you do is you cut them out, and I'll show you how you cut them out. So these colours are designated for yin and yang, and that's left brain and right brain. So what we'll do is we'll pop the left brain ones on you first, and you're nice and strong, and then we'll do the right brain. Okay, so she's right brained. Then we'll do the two lots there. Should have already been done, so. Okay, let's just cut those up. Oh, there they are. I thought we got them already done. So the next question is she in the lower part, the green zone of the right brain? No, so she must be in the blue, so we'll put the blue ones on. No. I'll describe all these and what they mean in a minute later. Paul? Yeah, so she's going on that one. Okay, so this one is I'll have to take it to the light. is triple warmer. So remember the points for triple warmer are on the eyebrow. So at 10 o'clock and 2 o'clock. So we do right to left. Okay, so remember it has to be one side, one brain to the other. And hey presto, again it's left to right with the triple warmer. Okay, so muscle associated with the triple warmer. Sartorius? No. Teres minor. Right, so keep the hand flat, push against me. Okay, push outwards. Okay, what's the other muscle associated with triple warmer? Infraspinatus. Hand out flat, push the hand towards the floor. Go on, push. Okay. Are you homing in on that? Just really push, go on. Okay, you can see, can't you? They don't have to. Right, so push this one towards the floor. Okay, nice and strong. This one, push towards the floor. Okay. So you saw that, and then you'll be just amazed how strong that is in a moment. So let's do her sensory input. So let's do the right eye to the left eye. Okay. So we're going through the 5 reflexes here. Okay, swap over, do the left eye to the right eye. So she went straight in. And the reason we do this is because you've got visual problems. You said you've got short sight and long sight. Okay, so you stay touching there. So that's left to right, so let's give her some therapy there. Triple warmer, teres minor, and infraspinatus. What? Oh, with the right brain are yang, and with the left brain are yin. We'll deal with all that in a minute, so as we get into, don't worry, when we look at faces and things. But the whole concept of what we're going to teach, for most of you, will be very new. But we now know that she's right-brained. She's in the upper part of the right brain as far as the perception. She's in a very good level of perception or consciousness. But it is the triple warmer, that's where she's coming from, and the emotions associated with the triple warmer. But the emotions that she's laid down, which are holding her there, rather than going on above, are first of all visual. I said to her when she asked me about it, I said, you don't want to see something, do you? And she told me the story, because most people with short sight develop it during teen times. And there were certain incidents that happened that she doesn't want to see. So she didn't see it. So she formed short sight. Don't worry, I'm long-sighted, so I don't see things in front of my nose. Haven't for years. Okay, so take those off. Now to the ears. So right ear to the left ear to the right ear. Okay, next finger. Okay, up the nostril. On one side. Right to the left to right. Okay, next finger, 4th finger, tongue on the right, tongue on the left. Swap over. Good, we're okay there. Now, tickle yourself on the right, tickle yourself on the left, stop. Swap over, tickle yourself there, stay, bang. Okay, so touch is the next one that's come up. The whole of this only literally takes a minute, with say roughly a minute to do the test in between. So if all 5 come up, you don't have to allocate very long, but it's a very, very useful part of the whole therapy when you look at a person. It's worth dedicating that extra 5 minutes at the end of a session by hook or by crook. If you can cut the chemistry down a little bit, with the time involved, and do this, it really does help tremendously to lock it in. Sorry? Are you short-sighted and long-sighted on both eyes? Yes. Makes no difference. You can and you can't. You'll find that if you use the colours, you will find those nutrients again match exactly the colour there. So if I left the triple warmer on there, you'd find exactly the blue nutrients will show up. Nothing else, just those blue nutrients, generally speaking. So we're looking there, she wouldn't be the B6, she'd be the B1, wasn't it? The folate, B12 and choline. So you stay there and let's just test those. Okay, pull. Okay, now we've got ears, haven't we? Go back to the ears. So right first to the left. Okay, okay. Then we got the nose next.
Go left to right there.
Oh yeah. So now do the nose. So second finger right to left, and then left to right. Good. Now the tongue with the fourth finger. Whoa. So we've got taste as well. Okay. So we've got 3 come up here so far. What you can find at this stage is, let's just turn that off a moment, is just take your fingers off. The quick way, as we'll see tomorrow, is just to test her with the colour again, okay, the triple warmer colour, and you'll find she's still weak. That tells you there's another one in there still, okay. It's just a quick way of doing it.
So we'll put these back on again?
Put the, yes, left to right there. Yeah, you go through them again because they'll come up in a non-specific order, but only one will come up that I've observed. I never found more than one at a time. But then you go right back, and sometimes I do the eyes, ears, touch. They're the big 3. But from a point of view of flow, I did eyes, ears, nose, mouth, and then touch. But touch is a big one, yeah, really big. You know, I don't know why, but it's, as I say, there's good feelings, nasty feelings. There's nice taste and good, nasty taste. But don't talk to the patient when they got the fingers in the mouth, because they're bound to take the fingers out the mouth to talk back, and then you lost it. Okay? You cannot do this yourself. Okay? Somebody else has to hold it, because you've got to get down there to turn the light on. And as soon as you remove it to turn it on, you lost the reference. So it's really annoying, that. Unless you stuck this to the wall and leant against it. But what voltage is it? What voltage, Clive? Technical question. What voltage is this? Yeah, but the transformer's in the plug there, not in here. I think it's 6, isn't it? I think it's 6 volts out. He wants to attach it to a battery. Do they do batteries? He works in a very rural area. I'm sure Clive will find you a solar one somewhere. Or would you like a wind one? We could use those fans for a wind one, yes. Okay, back to the ears, right ear to the left ear to the right ear. Okay, what we got left? We've done that. Nose. So, were you a fussy eater? Yes, she was a fussy eater. Yeah. Okay, so what we should find now is the blue will no longer weaken. Okay, now remember at this stage I'm going to just do the conscious points as well, as we call them, there and there. So right to left and then swap over. Never forget those, because they lock it all in. Because if you could deal with the subconscious, you're dealing with the memory, but you want to stop new input consciously going in right now. So we'll give you 1 more minute of that.
Where's that, Chris? Is that between the eyebrow and the ESR point?
Yes, it's exactly the same place as the ESR, but lower. Okay, it's just literally about. Imagine, you know, if you know a skeleton skull, it's literally the orbital frontal cortex sits on the orbit. It's literally in there. It's this idea of, you know, holding higher up is fine for a neurovascular, but that is actually not where the orbital frontal notch or area of the frontal lobe is. It's a very small area in there, but it's where the spirit, if you like, makes decisions. Yes, and this, by changing the person's conscious way of thinking, you're then going to rewrite the programs from now on. What we've done is the subconscious is rewriting the old. Well, not rewriting, it's just What we're trying to do is create harmony in there. Okay, this is all. We're trying to balance her left brain and her right brain, so they don't argue anymore. Because all disputes and stress is an argument between the left and the right brain. Animals don't have laterinization or specialization of their cortex. That's why they don't argue. You know, they survive. They can be frightened and things, but they don't argue about what they're going to have for dinner. They don't argue about what they're going to wear or which girl, which bitch to go out with tonight. You know, you look at a dog, it's happy, isn't it? You know, it'll be worried if there's something that threatens it, but that's survival. But it doesn't throw this round and starts to think, now if I go that way or I go that way, you know. Okay, so you should be fine now. Now the big test. Okay, hand out, push towards the floor.
Tried hard.
You tried hard. Bit different, isn't it?
Yeah.
Yeah. There we are. So that'll do you. And what I will just do, could I, actually probably going to buy the drops anyway.
Yeah.
If you give, I'll get a glass here. And let's just test the nutritional drops. The blue. Blue vitamins. Aren't they lovely labels? Have you seen the new labels? Aren't they nice? They're lovely, aren't they? Okay, so you hold that. And of course, what I've done is I lost my marker now. So I made it...
Try GV.
no, well, nothing will work because I lost my marker. Okay, so you can try GV20, but I don't think... You know what? She won't weaken to really... Occasionally you might be able to get it back, but I think what we'll do is I've already measured her. We're using a hair sample, so I know what the answer is.
Yeah, I'm pretty strong now.
Yeah, you're pretty strong.
Can't catch
But
me.
yeah, you can't catch me. But that will come back if you don't lock it in with the nutrition.
Yeah.
What we've done is she's got to have the nutrition, and I've already measured her using a hair sample at 2 squirts 3 times a day, okay, for 2 weeks, and then you cut it to once a day. So what you need is 2 squirts. You know, so she needs a little of it often, and then what you do is then you cut it down to once. If you get any nausea, make sure you take it with food or in juice or water, but with food. Because it's got zinc, it will sit there and can cause a bit of nausea on an empty stomach. So don't be brave and oh, I'll take it on there. Do you have meals at regular times?
Yes.
Because not everybody does. Some people eat when they feel hungry and so on, so that makes it a bit awkward. Oils, we go usually for 2 teaspoons is a fairly average dose. Okay, so 2 teaspoons. So what I did with patients, and we'll do that, is you find the dose, say the 2 squirts in there, that strengthen her, all right? And then we go to stomach time. We therapy localized on stomach time. She stays strong, okay? We go to circulation sex time. She stays strong. That's the evening meal. We go to small intestine time. She stays strong. Any other body clock point on the alarm points will go weak. Okay? So the time when she stays strong is the time she takes it. So if you do this, you'll find always with oils, it'll always be circulation sex. Every other time goes weak. With a probiotic, it'll always be triple warmer. Okay? With amino acids, it's always breakfast time. Okay? There's always a pattern for everything. And if you want to do it with medication, do the same thing. What time should you take your medication? I sometimes still prescribe Ovex. You know what Ovex is? Mebendazole, isn't it? It's an anti-parasitic pharmaceutical. Very good for threadworms, sometimes other worms as well. But if you muscle test it, it's always triple warmer. You should always take it, really, it works best last thing at night. Okay? So just before you go to bed, triple warmer time is the best time to take it. Okay, yep. I'm sorry about that. I should have done that. I should have listened to Jenny. Do you leave it on? We should have done that. Okay. So I have. Yes, yeah. As I say, I would, because I can't test it and I've already done it. 2 teaspoonfuls of oil,
Yeah.
and 2 of those 3 times a day. And use your tea. Use your spices as a tea. All right. Probiotic. No, I don't think your gut's all right. What? Oh, you stay off the milk, yeah. Sorry? Spinatus?
Yeah, which is immune.
Which is immune system, yeah.
So possibly
What, a probiotic? Yeah, she didn't, when I tested the hair sample with her, she didn't show to a probiotic. As I say, I always have pre-tested, but I wanted to see her just to confirm a few things with her today. Right, Clive, we're going to need the acetates, and I think there's a box with the set. Have we got enough to give to each table for demos, or for the... Let's see. So what you'll get is the packet, not to keep, but just to workshop here, of the acetates, all right, so you can work on each other on the table. And what you do is you choose one person and do what I've done. Okay, test first of all therapy localization, and then test the cross reflexes, and then do the colours with both eyes. Okay, you're happy about it? You know how to do it? Good, excellent.
End of chapter 5.